Over 85% of all cases of heart attack and stroke have nothing to do with cholesterol, plaque, or artery blockage. The real killer, often ignored, is a deadly blood clot that forms in less than 5 seconds and silently shuts down your brain or heart. Doctors call it deep vein thrombosis, DVT, pulmonary embolism, or even silent stroke. But most patients don't realize what triggered it. It's not always your cholesterol. It's not always fat. Sometimes the real cause is something as common as dehydration, chronic inflammation, or even a tooth infection you didn't know existed. This is why even healthy eaters and normal cholesterol patients still collapse from a stroke. You're about to learn the overlooked signs, the dangerous triggers, and most importantly, how to stop the clot before it starts. Before we go any further, I want to share a story that just happened in Missouri. Carol, 76, has always believed that keeping your hair neat keeps your spirit fresh. Every 2 weeks, like clockwork, she'd walk to her favorite salon just a few blocks away. She wasn't just there for a trim, it was her ritual. She'd sit by the window, chat with the stylist about the local news, and laugh about the little things in life. But last winter, Carol didn't show up. The stylist grew worried and called her daughter. It turned out Carol had suffered a minor stroke, but not because of high cholesterol or clogged arteries. Her labs were normal. What the doctors discovered was a blood clot triggered by a recent tooth infection and compounded by dehydration. She had no pain, no warning, just sudden dizziness and a fall in the kitchen. Her story shocked everyone. Because Carol ate well, she walked daily, she wasn't overweight. But the hidden truth is, it's not just cholesterol that causes a heart attack or stroke. Sometimes it's a clot quietly forming behind the scenes from stress, sugar, or even a forgotten dental issue you didn't know existed. If anyone claims the reason you die is your arteries just getting jammed with cholesterol, they are lying to you. That's usually not the true killer. It's the clot, and that thing can form in less than 5 seconds. We're going to really take a hard look at a clot, get clear on just what it is, and then give you a solution to prevent clots.
Because a clot is a very necessary thing. A clot is a response to injury, and the way it's supposed to work is the body forms a clot, fixes the hole in the artery, and then dissolves it. The real problem that we need to focus on is the hole in the artery. You need to know that these clots are extremely dangerous, and spotting the signs early can save your life. In your leg or arm, what doctors call deep vein thrombosis, DVT, your leg or arm might swell up on one side, you could feel aching, tenderness, or a cramp-like tightness. The skin there might feel warmer to the touch, or turn red or kind of purplish. Even scarier if that clot travels to your lungs. This is an emergency. Signs include suddenly being short of breath for no reason, chest pain, often worse when you take a deep breath or cough, maybe coughing up blood, a very fast or irregular heartbeat, and feeling dizzy or like you're going to pass out. And if a clot blocks things up in your heart, causing a heart attack, the common feeling is pain, pressure, or like something heavy is sitting on your chest. This pain can spread to your arm, usually the left one, shoulder, back, neck, or jaw. You might also have shortness of breath, break out in a cold sweat, feel nauseous, or be extremely tired. And when a clot hits the brain, causing a stroke, remember FAST. Face. Is one side of the face drooping? Is their smile uneven? Arms. Is one arm weak or numb? Can they raise both arms evenly? Speech. Is their speech slurred? Are they hard to understand? Or can they not speak at all? Time. If you see any of these signs, call 911 immediately. Don't ignore other signs like a severe headache, dizziness, or loss of balance.
But the biggest trigger for a clot is not cholesterol. It's not calcium. Number one, and people know this, is inhaling smoke from cigarettes. Now your arteries are exposed to all these chemicals and it's going to create inflammation. Also pollution, or being around any type of chemicals in the environment can do that as well. A solution is not to do vaping, okay? You need to just stop smoking. Alcohol is another one. You're drinking alcohol, it's considered a poison to the liver, it gets into the bloodstream, and that also can create problems on the inside of the arteries. Believe it or not, birth control pills or hormone replacement therapy is another thing that can actually affect the arteries because of the hormonal interaction, increasing the risk of a stroke and heart attacks. Then you have stress, and this is an interesting one because there's something called the broken heart syndrome, where someone has a loss of a loved one, and the risk of having a heart attack goes up by 2,000%, which, by the way, triggers the clotting action. Anything that increases stress can increase the clotting action. Also, surgery. Okay, surgery is a very stressful thing to the body. And endurance sports, marathons, it's a tremendous stress on your body. And refined starches. That's just like pure inflammation going through your arteries. And this is why diabetics are at 4 to 5 times the risk for getting clots, not just in the heart, but in the brain as well. The last thing that can trigger these clots is an infection. It could come from an infection in your tooth, from a failed root canal where you have this abscess that's leaking bacteria into the body, or it can come from some other chronic infection.
I think for most people, it's going to be the high levels of sugar that's flowing through their bloodstream that's creating the problem because of their diet, and it makes their blood really sticky. Also, it chronically elevates inflammation. Inflammation is one of the most potent things for clotting. There's another trigger for this clot as well, an excess amount of calcium in the arteries. And let me explain this, because in certain studies involving postmenopausal women who take high amounts of calcium for their bones, they have an increased risk of getting this clot because calcium is involved in over 15 different clotting factors. I'm talking about excess calcium. Excess calcium is just not good for the heart. It can cause excessive calcification in the soft tissues, especially in the artery walls, causing hardening. Number 1 is vitamin K2. The main purpose of vitamin K2 is to direct calcium to the right places. Instead of letting calcium just build up randomly in soft tissues, especially in the artery walls, causing hardening, K2 helps shuttle calcium into your bones and teeth, where it's actually needed. Simply put, K2 helps keep your arteries clean and flexible. And guess where vitamin K2 comes from? It's abundant in fermented dairy products, like Japanese natto, egg yolks from pasture-raised chickens, butter from grass-fed cows, and animal liver. Fatty foods that some people might still be wary of because of cholesterol, but are super rich in K2. You should always remember that vitamin D and vitamin K2 are a perfect pair. Vitamin D helps your body absorb calcium, and K2 makes sure that calcium is used correctly. Plus, vitamin D is also super important as a powerful anti-inflammatory for the inner lining of your arteries. Next up is magnesium. This is an essential mineral that acts like a calcium gatekeeper, helping to prevent too much calcium from entering cells and soft tissues, including artery walls. Magnesium also helps relax blood vessels, improves circulation, and is especially important in preventing heart rhythm disorders, particularly atrial fibrillation. Atrial fibrillation is a heart rhythm problem that can cause blood to pool in the heart chambers, significantly increasing the risk of blood clots.
So, what else helps lower the risk of blood clots? A hugely important factor is nitric oxide. This is a miracle molecule our bodies produce naturally that helps dilate blood vessels, allowing blood to flow more easily and preventing platelets from sticking together. Some things that can help your body boost nitric oxide production include vitamin D, there's vitamin D again, L-arginine, this is an amino acid your body uses to make nitric oxide. Some of the best natural sources of L-arginine are red meat, especially from grass-fed animals, poultry, fish, and liver. Foods that sometimes we're told to limit. Sunlight doesn't just help your body synthesize vitamin D, it can also penetrate deep into the body and stimulate nitric oxide production right inside the artery walls. This is why getting sensible sun exposure, not baking in harsh sun, is so valuable for heart health. Don't be overly afraid of sun exposure because of the risk of skin cancer, melanoma, like a lot of information since the 1980s has led us to believe. Regular, moderate sunbathing is actually very good for the heart. Besides these, there are many other natural warriors that can support you.
Polyphenols. These powerful antioxidant compounds are abundant in natural herbs like green tea and brightly colored fruits and vegetables. Vitamin C helps strengthen blood vessel walls. Omega-3s. Omega-3 fatty acids found in fatty fish like salmon, mackerel, herring, flax seeds, chia seeds, and walnuts naturally thin the blood, making it less likely to clot. Vitamin E is a powerful antioxidant that helps protect cells and may help prevent blood clots. You can find vitamin E in almonds, sunflower seeds, unrefined vegetable oils, and whole grains. When it comes to vitamin K1, different from K2, okay, which is abundant in dark leafy greens like spinach and kale, some people worry that eating a lot of it will increase blood clotting. But no, vitamin K1 is essential for your body's normal clotting process, helping blood clot when you get injured. Consuming K1 from food just helps bring your clotting process to a balanced level. It doesn't cause excessive clotting.
Intermittent fasting is also a surprisingly effective way to help reduce the risk of blood clots. Fasting helps your body clean house, reduces inflammation, and improves many health markers related to heart health. Similarly, adopting a ketogenic diet, keto, a very low-carbohydrate diet, also powerfully reduces inflammation in your arteries, thereby lowering the risk of clot formation. And of course, you can't forget about drinking enough water. Water helps thin your blood and improve circulation. When your body is dehydrated, blood tends to thicken, increasing the risk of blood clots. Regular exercise is extremely important. I'm not talking about high-stress workouts like running marathons every day, but regular, appropriate exercise for your fitness level, maybe brisk walking, swimming, cycling, combined with proper recovery. Exercise boosts blood circulation, prevents blood from pooling, especially in the legs, and significantly reduces the risk of blood clots. Garlic and onion, super important in preventing blood clots. Garlic contains allicin, which helps prevent platelets from sticking together. Ginger and turmeric, with its active compound curcumin, have strong anti-inflammatory and anti-clotting properties. Cinnamon and cayenne pepper are also known for their ability to improve blood circulation.
As for supplements, there are 3 that are really powerful. Nattokinase is a natural enzyme that helps prevent blood clotting. You also have another enzyme called serrapeptase, which is an extract from silkworms, and then bromelain from pineapple. When you take those enzymes to help reduce clotting, and I'm not even recommending you take them unless you have a clotting problem, but they're a great natural source that's not endorsed by Big Pharma because they're competition. You want to take those on an empty stomach so they can actually work on the factors in your blood that might be too excessive. So many of us fear cholesterol, but overlook the silent warning signs of a blood clot until it's too late. Heart attacks and strokes rarely knock on the door. They come unannounced, quiet, sudden, final. But here's the truth. The body whispers before it screams. That tightness in your leg, the shortness of breath, the moment of dizziness you brushed off, could be the only chance your body gives you to act. Don't wait for the chest pain. Don't wait for the slurred speech. Don't wait for the regret. If you or someone you love is over 60, has chronic inflammation, a history of infections, or even just high stress levels, it's time to pay attention. Learn the signs. Fix the triggers. Protect your heart, your brain, and your life. Because the next clot may not give you a second chance.